Our next speaker actually prefers to be known as a singer. He's a karaoke champion, often scoring 100%. He actually asked tonight if he could sing this whole thing. His name is Renzo. He goes by Renzo, I should say. He goes by Renzo Ginto. He's a doctor from the Philippines. He's a new transplant to Harvard University, and he's exploring the intersection between global health and climate change. Please welcome to the stage karaoke champion Renzo Ginto.
In December of 2014, I visited the town of Mariveles in my home country, the Philippines. Mariveles is known for being the starting point of the historic Bataan Death March during the Second World War. Around 80,000 Filipinos and American prisoners of war were made to walk by the Japanese troops for nearly 70 miles. 20,000, a quarter of them, died along the way. Today, the people of Mariveles are struggling to survive yet another death march. This time, the culprit is not a foreign invader. Rather, it is a dirty industry that is polluting the air, water, and land, and most especially affecting people's health. And that is coal. During my visit, I met children unstoppably coughing as they inhaled the noxious fumes emanating from the coal plant's chimney. A mother even sobbed as she narrated to me the death of her 3-month-old boy, and she was attributing the death, her son's leukemia, to the toxic chemicals released by the coal plant to their drinking source. Even the fishermen were complaining of declining catch, and they showed to me the coal ash floating in the seawater. And the local health facility is also not immune to the environmental pollution. Its roof and windows were all coated with coal soot. Indeed, coal is killing people's lives. And not just by driving climate change, which the Philippines, as one of the world's most climate vulnerable countries, is already experiencing today. But coal is killing people directly and instantly. Coal emissions have a direct effect on the lungs, heart, brain, virtually every organ in the human body. Even unborn children develop congenital anomalies due to exposure to heavy metals while still in their mother's womb. And what's worse is that communities are disproportionately affected, with the poor and the marginalized suffering the greatest. When I went to Mariveles, the people were all excited because they thought that I, as a physician, could eradicate all their ills. Yes, I may be trained in treating asthma or hypertension, but I know that the medicine that I prescribe is not enough. I felt the need to step out of my clinic to target the root cause of the disease itself. And so 2 years ago, I joined Healthcare Without Harm, which is an international environmental health organization, to establish the Healthy Energy Initiative in the Philippines. And through the initiative, I have been engaging with policymakers from both the health sector and the energy sector, and also mobilize communities and health professionals to advocate for the phase-out of coal, but also to demand for healthier energy choices. For sure, coal will not disappear overnight. But slowly, we are now seeing the signs of coal's decline. For instance, last April, Peabody Energy, the world's largest coal company, already filed for bankruptcy. Developing country governments like Costa Rica and Vietnam already committed to a transformed economy powered by renewable energy. And on certain days last May, both Germany and the United Kingdom met their electricity needs without burning coal. In my home country, A change in government is about to happen in a week's time. And 3 days before I arrived here in Aspen, our incoming president appointed one of the staunchest anti-coal activists as his Secretary of Environment. Moreover, in the Philippines, you can find not just the biggest solar farm in Asia, but also the world's largest solar-powered shopping mall. And as a doctor, I am deeply optimistic as more and more hospitals are cutting their addiction to coal and instead putting up solar panel systems, a clear demonstration of the Hippocratic Oath to do no harm, not just to patients, but to the very planet that nourishes our health and well-being. 70 years ago, the Bataan Death March ended in death. It shouldn't be the same fate for the people of Mariveles and all the other communities across the world hosting coal-fired power plants. Coal is a cheap drug we can no longer afford. And so, as a doctor, let me give you a new prescription for global health. Not in the form of a pill for temporary relief, but through preventive medicine on a planetary scale. Coal kills, and so together, let us kill coal and create a pandemic of health. Thank you.
Thank you, Renzo. A very, very powerful message for us all to think about. Thank you very much indeed.